ahead and get started. Thank you guys so much for joining. I'm Dr. Jess Daigle, board certified pediatrician and NICU doctor and founder of Mom and Me by Jess Daigle MD, which is an upcoming in-home and virtual care, postpartum care practice for moms and their new little babies. And the idea is to serve moms in a time that's both trying and new and can be often overwhelming, but to help them ease that transition home from the hospital with their new little baby. And one of the things that comes up, well, a lot of different things come up for moms during this time. And we don't often talk about it as new moms for either fear of looking like we don't know what we're doing, or we really don't know that there's information or help available to us. A lot of us are in isolation. It used to be when you had a baby, all your family would descend upon you, and everybody, moms, grandmas, and aunts, would be around to help you. And a lot of moms are having babies in isolation nowadays. And so either they're out of, the state from where family are, or they're somewhere because of work and they haven't really connected with a lot of other people, or they don't know a lot of other moms that can help them during this transition period. So I wanted to talk about that today, and I'm talking about that with Dr. Janet Williams. She is a doctor of nursing, and she's a certified nursing midwife and also has her master's. And she's also the founder and CEO of Transitions Women's Health Consulting, which focuses on helping professionals deal with implicit bias in themselves and in their organizations, and helping to curtail that. Her goal as well is to help moms in this area as well have their best experience in pregnancy and afterwards as well. So thank you, Dr. Williams, for joining me.
Thank you so much. This conversation needs to be had. Like Dr. Daigle said, that I am the CEO of Transitions Women's Health Consulting, and I wanted to talk today because like she said, there are so many questions that moms would never ask. They've never heard any other mother state some of their concerns. So they keep it inside because they think it's just them feeling those things. And as a midwife with 18 years experience, having talked to so many patients and their family members, I know that no two pregnancies are alike, no two periods after pregnancy are alike. This is not only for new moms, this is even for moms that have other children. Each pregnancy, each recovery period is alike. So it's each woman's story and each situation is different. So this conversation is really important. And I think that even if they don't ask the questions, they may hear an answer today that they didn't ask.
Exactly. That's good. So we were when we were talking, we were like, what are some things that moms don't want to talk about? And one of the things that came up was breastfeeding. And so, we are in a formula society. It used to be that breastfeeding was heralded, and then it kind of sloped off with the introduction of formula and the promotion of that. And then, over the last, I would say 10 years, at least for me or so, I've seen more of a push back towards breastfeeding, but you're still competing with those old narratives. And I find in the hospital, a lot of it has to do with like the education. I called it the 3 E's: education, exposure, and experience. So in order to, in my mind, and what I've seen to successfully breastfeed, you either have to have exposure. So some people around you have been breastfeeding and you kind of see a little bit of what to expect. You've either done it before too, which that exposure can be part of the experience as well. And the education. So getting the right information about what to expect, especially early in those first few weeks when it comes to breastfeeding, because that's the time that a lot of families give up because of the misinformation around how much your baby should be taking in, how do you know they're getting enough. And I've been on a mission to improve that as I go around the hospital. So I'll alert the moms the first night when I meet them, hey, your baby's going to want to start doing cluster feeding, which means they're going to want to be on the breast almost every hour. You're going to feel like, I feel like I just fed that baby. And yes, you did, but the baby is trying to help you get the supply up for what they will need eventually. And so for the term babies, the colostrum is usually enough but your baby is going to be growing. And so your body needs to be able to accommodate that too. And it can, it's just that breastfeeding is supply and demand. It needs the demand to know, hey, I got to bring that supply in.
Correct.
That's definitely one of the things that people don't talk about their struggles. They just go to, well, you know what, I know there's this formula here, so I'm going to use that. Or they have family that's just like, hey, you need to feed that baby more because we think more is better, you know, and not the case.
Yes. I find in the hospital, we start teaching the women about breastfeeding early in pregnancy, and we talk about it, and we talk about how big the baby's stomach is, and how when when the baby's first born, that they're not going to have a milk supply at first because they're expecting to, have that. So we talk about that before, because if you wait until they deliver, it's too late almost, and but unfortunately, one thing that I do find is many times the patients have the information, but their extended family does it. And that's sometimes where the conflict comes in. So one thing that I do is when I have a client that comes in with her mother, even if we've talked about breastfeeding 10 times, that day I'm going to talk about breastfeeding because I want the mother to hear what I'm telling her. Many times when I walk in a postpartum room and the mother will say, not the baby's mother, the grandmother will say, this baby needs a bottle. And then the patient's conflicted because her mother's telling her one thing and we're telling her one thing.
Yep.
And, I try to do education at that moment, but it's better if it's heard ahead of time, and many times the baby will be spitting up. They'll burp the baby and the baby will spit up. And then you find out they had a bottle at some point and they're very pleased to tell you the baby drank this much. Yes. And I say, but the baby's stomach is this big. It's the size of a marble. And I equate it to Thanksgiving dinner. That's how I try to explain it to them. And I say, have you ever gone somewhere and the food was really good and you ate and you felt really good? And so you had a seconds. How did you feel after you ate seconds? You didn't feel so good. I said, because now at this point, your stomach was really too full and now you didn't feel well. I said, that's kind of what's happening with the baby. The baby's crying and spitting up because they've been overfed and they don't know when to stop eating, And so they're like, oh, okay, so that lets them know that, that more is not better. The baby's stomach is going to accommodate what it needs, and but that, like you call it cluster feeding, I tell them it's an all-day buffet. The baby's going to eat and sleep and nap and fall asleep and wake up and eat again. And it's not to say that it's not enough. That's just how the first few days is.
This is just what you to expect. And again, I had a mom today at the hospital that said, I'm glad you told me about that because that's exactly what he did. And I was reassured that nothing was wrong.
Right.
And so, even educating them about how do you know something's going in, stuff's coming out. They'll have that one wet diaper, that one poop. And again, the more is better. And we're competing with old information, and it doesn't help that you have these formula bottles that at the hospital that has 60 mLs in it. Like even that packaging alone, because like in my culture, if you didn't finish everything, you wasn't right. Like your mom
eat everything on your plate. Right.
On your plate. Yeah. And mentally you see that. And so you think, just like when if they're giving you a medicine in the hospital, they give you a specific amount, like they're giving you the amount that you're supposed to take. So if you're giving a bottle that's this big, psychologically, you're thinking, well, this must be what my baby needs to eat.
Right, exactly.
And so the formula companies are actually hurting that whole narrative too, because if they were really trying to educate and help, they would make these little 15 ml little bottles.
Right.
We're telling them to throw them away anyway, and that's wasteful because they're not going to eat all of that. And I tell my families, because they can doesn't mean they should. So yes, the stomach can stretch to accommodate, but should it have to? No, and again, it's the education piece. So I take on the families too, whenever it's like that. I validate, like, yes, I can understand how you would think that the baby needs more, but it's really understanding the truth about it, and so educating the family is a big part of it. And it's going to take it one family at a time, like everything else. It's going to take one family at a time and getting ahead of the narrative of understanding where the challenges are going to be, namely what they're going to be thinking, like get ahead of addressing. I know you're going to worry, how do you know your baby's getting enough? I know you're going to worry, well, they're crying, so that must mean that they're hungry. And when the formula culture, it is this, you feed the baby and put them away. So it's easier, or it appears easier at the onset, but that's not technically what's natural. When we talk about natural, it is more natural for your baby to want to be on you all the
Be
time,
on you, yes.
cuddling and things like that. We see that in a lot of other cultures. It's just over here, we're about whatever's easier, and it should be that way. Now, I'm definitely not a shamer, because there are medical instances where a baby does need to take in some formula, either in addition to or exclusively, but that should be informed decision, meaning you're making the decision based off actual information that's the truth. Again, not an assumption or an old way of thinking, so to speak.
Right. And there's some mothers that really just don't want to breastfeed, but we have to make sure that we've explained to them the benefits for mom and for baby, and that they understand it, and then they can make an informed decision.
Exactly. Yeah. And I, unfortunately, I found too that a lot of it depends on how the staff too, like, even as a pediatrician, I knew the benefits, but I didn't appreciate the struggle and the things that I would need to address, even as a health provider, until I breastfed my own kids. Then I knew too. So that experience, even for me personally, has improved my education and help to my families, because I do know the hurdles personally as well that try to come, and the things, the mindset, the getting tired, the sleep deprivation, all those things that do come up, that you have to figure out a way to curtail so you can continue on that journey and be successful as you desire. So one of the other things along with that, while we were talking about family, one of the other things that moms don't talk about is the change in their dynamics in their family, like their relationships with the spouse or non-birthing partner, and like their mom or their friends. And so that's one of the things I'm going to talk about in my workshop that's coming up next week too, is that's one of the facets of things that does change when you bring home a baby, and you don't really think about it until you're in it. Because and to be fair, no one can really anticipate how you will handle having a baby until you have one. Like, I'm a much different parent than I thought I would even be, to be honest. It's just like, I've kind of, as I've walked it out as I've had my kids, and I'm like, oh, that's interesting. I didn't know I would feel that way about that, or think that way, or want to do this, parent this kind of way. So in some aspects, it's hard to anticipate it, but it's good. I think we can do a better job of saying, hey, expect that there may be some changes, and this is a way that you can manage it. And it really boils down, I think, to communication, like everybody sharing what their experience is since the baby has been home, because everybody is impacted by it. It's a change.
Yes. What I found from my own experience years ago when I had my son, I was a teenage mom. I was 18. I was married, but my life and my friends' lives were totally different. Once I got married, it was changed somewhat, but once I had the baby, it really changed. And I wasn't expecting that. That was a big shock to me, I think. Like, I had never thought about it, because these were my friends for like many years. And what it was is they were going away to college at that point. They had other interests. My interest as a mother now went this way, and they were doing other things. So it gradually, our relationship basically went two separate ways. We kept in touch, but it wasn't the same relationship. And at first it was kind of hurtful, I felt kind of isolated and that sort of thing. But then as they began to get married and get engaged and have babies, then we came back together, and I was pleased because we did keep in touch. Even though we had kind of gone off on two paths, we did keep in touch. We didn't get in our feelings and kind of break up the friendship, and we did come back together. And I don't think we really talked about it until they were in that situation now. And then it was like, I said, my feelings were hurt. You came over, you looked down at the baby, you stayed about 15 minutes and you were gone, and and it was like, my feelings were really hurt. I didn't expect that. So just even hearing this kind of prepares you to realize that, you're a changed person once you become a mom. You have new responsibilities, and that baby is like the world to you. And some other things just are not important anymore. And so some friendships are going to kind of fall by the wayside for a while. It doesn't have to mean that they're over, but you need to understand that. and understand that as people get into other areas of their life, that it can come back together. If you keep
Yeah,
the
it's like
communication, you know.
seasons. Yeah, it's like a seasons and the transitions and
Yeah.
it takes both parts, and that's where the communication comes in. So I advise people, especially if you are, single and your friend is getting married or having kids or whatever, you can still check in and just say, hey, just thinking of you. And that's like my rule that I do. If I think of someone, I just send them a quick text. Because I think I must have thought of you for a reason. So either you need me to check in, or I need to say a prayer for you, or something might be going on in your life, kind of a thing. And then one of my friends, I've actually put it on the calendar, like call her like, I don't know, third Sunday or something. I don't know, something like that. Like, because you do get caught up. You realize, especially once you have kids and you start, especially the older they get, and you're doing things like they're in sports or they're in this or that, and if you're working, your day is limited. You already got like 8 hours. So 8 hours of it is supposed to be sleep, which already limits you to what is that, like 16 hours left of the day? That's not that much time.
It's not.
And then the other 8 of that, if you're working, then that leaves you with 8 hours. And then 1 hour of that is you try to unwind. 1 hour of that is you might be trying to cook dinner. And then that's 6 hours. And that might be 2 of that is probably in traffic. So you really end up having like 4 hours sometimes, like in your day, that you could really do a lot of what you want to do, unless you have somebody else that's stepping in the gap, like somebody else is taking your kid to soccer practice. So then you have that extra 2 hours or things like that. And that was one of the things too that I'm going to talk about in the workshop, is why it's important to have help, because you do have a set and a limited amount of time. So if someone else, if you can delegate, that means that person who also has that same 8 hours can be maybe doing something that's helping you. So it's not your 8 hours, but some of their hours that they designate, hey, I actually have 2 hours of my day that I can help you with this or that, because my priorities are a little different, or my life is a little different. And it's just understanding that ebb and flow. And it is hard as a mom, I can tell you. Then as women, I think in general, we come in a culture of where we feel like we have to prove ourselves anyway, because it is a male dominated society, and in so many facets to that, whether you're a white woman, Black woman, all these different things, all these layers factor into your perception of yourself and your identity and what you're able to accomplish, right? So already you're like, I have to prove myself. Well, a lot of us grew up in that type of environment because the opportunities were different. So you take that mindset into everything else that you do. So you do it in your job, you do it at home, and then you end up trying to do it with your kids and yourself. Like, oh no, I can't show, like asking for help is considered a sign of weakness internally. But what we're finding now is that's starting to actually weigh on the mental health of women.
Yes.
Basically everybody's being affected by that type of burnout and that need to be on all the time type of mentality. And so what I realize is you taking care of yourself, which is my message to women, is is the only way you can really take care of someone else, because eventually something's going to give.
Yeah, you can't pour from an empty cup. You can't.
You really can't.
The other thing that with asking for help, what I hear from my women that I work with, many times they'll say, I'm so tired. And then you hear what they, I'll say, so tell me, tell me how your day goes. And people will want to help them, but they're not specific. They think that it's almost like they think that people are mind readers. I said, you have to be specific. When someone says, what can I do to help you? They're asking you, they're serious, but you have to tell them what you need them to take off your plate. Okay. So if you need your husband to change diapers, then be specific and say, it would be helpful if you could change the baby's diapers at night, or if you could do the 2 a.m. feeding, or if you could take over the laundry, or whatever it is. I hear husbands and partners and family members that, for instance, wash the dishes. But then the mother will say sometimes to me, but they don't do it as well as I do it. I said, let people do what they can do for you. Don't be critical when they try to help you. Sometimes as women, we can be very critical about things, and then people don't want to help you, especially partners, especially partners. I know from experience. I remember when my husband used to cook all the time. He's a great cook, but I made a comment about the kitchen after he cooked once. And when we did the kitchen over, he stopped cooking as much. And he said, no, because I don't want to mess up your kitchen. This is what he would say to me. And I realized, wow, that was a mistake that I've ever mentioned that. But we have to learn to ask for what we want, and we have to let people do it their way. Like if someone is cooking, let them do it their way, unless it's like something serious like an allergy or something. Let them wash the dishes their way. Nobody's going to do everything the exact way that you do it, you know? So for that time, say, this is going to give me time to rest. This is going to give me time to take a nap, bond with my baby. And, you know, that's pretty much it. One of the best gifts I think I ever gave a friend of mine who was an OB nurse, and she had her baby, and we went to visit her, and she was exhausted. She just looked exhausted. Everybody was bringing presents for the baby. I brought her a pack of like bath salt, bath products, and lotion and that sort of thing. I came in, she had a little toddler and she had a baby. I said, give me the kids in the living room. Goodbye, go take a bath, go take a nice shower or bath, and go take a nap. And that was her present. And she said that was one of the best presents that she got, because it acknowledged her that she needed help. I took care of the kids for it was only about 2 hours, but she was able to relax and not have to worry about that. So asking for that, she didn't even ask, but that's a great gift for people.
I agree. I think I've said it on other platforms, but we need a mom shower. Like it's called the baby shower, but it needs to be called the mom and baby shower. We did one for one of our colleagues, and she wanted to do it called a mother's blessing. And it is where we actually was focused on the mom and doing like ritualistic type things and things like that. And that was so
call it a blessing way. That's what we call it.
Yeah, that's right.
Yeah.
So you know, it's just acknowledging that this mom is a big piece of this baby getting here. And you know, the whole family dynamic, and it's every person is important to making sure that the mom does well. And as women, we want, when we feel well, when the things around us are thriving too, but we also have to realize we're central to that. So us doing well, it means everything else from us extends from us will have the opportunity to thrive as well. And you know, friends and stuff coming up, like you mentioned about your friends, like that was the opportunity for them to do like what you did, like say, hey, let us watch the baby while you and like take a shower or take a nap. And really the fact that someone cares enough does more mentally for you, like just that knowledge that someone cared enough to do it, that actually brings on another kind of peace. So because you know, the tiredness and all of that is to be expected. So I say we need to do a better job of normalizing, right? It's and like explaining, hey, these phases and these changes are normal, but it doesn't mean you have to be stuck in it. There are ways to help ease it and make it where you're thriving in this change, not just like survival mode, you know?
Right.
And understanding that. So we do, as a culture and society, need to do a better job. And I see a lot of people that are paying attention to these things. I've been hearing definitely more uptake about the fourth trimester. I didn't know if that's just because I've now also like been diving more into it. But I'm starting to see it so much everywhere, like different organizations, especially around mental health and things. And so that's one of the other questions, or one of the other things that we say, we're talking about how moms will feel disorganized sometimes, that it's hard to even like take a shower, or they just feel like lost. Like I remember I talked with a mom last week, or it might have been earlier this week, but just, you know, since bringing home the baby, it's just kind of like, she'll know she coming or going, you know?
I know, that is the feeling, but it's a normal feeling. That's the thing. And they need to know that.
Yeah.
You know? I wrote a journal, and it really came out of, it was during COVID. And like you said, a lot of the mothers, aunts, sisters that would have normally come to help the new mom couldn't come. And these moms were very isolated. I think even a new mom normally might feel isolated, but during COVID, that was a whole new type of isolation.
Yes.
You know, and there are so many changes that come when you're in the postpartum period. The hormones are raging, you know, the sleep deprivation, it just, your emotions are like up and down, it goes from joy 1 minute to stark terror the next minute.
Yes.
And so people, I think, were more locked into social media and television, that kind of thing. And, that there's a transitional period there, and people are seeing on TV, you see the new moms on all these shows. They look so wonderful, they're glamorous. They're on TV. They have makeup artists, they have people taking care of the baby, they hand them a baby that's already dressed. But when you watch TV, you don't stop to think that this isn't really the deal, And when they're on social media and they're seeing these new moms on social media, that's 30 seconds to 30 minutes. Like anybody can look good for 30 minutes, and they think they're the only ones that are crying or exhausted. But when that mother turns that social media off, the one that's on it, she's just like you, And so I tell them, don't believe the hype. You see, they turn it inward on themselves, and then they get depressed and they doubt their own mothering skills and that sort of thing. And that's crazy, because everybody's going to have some ups and some downs, some fears, some joy, periods of joy. It's transitions. That's why my company's name is Transitions. We're always changing constantly.
Good.
So it's normal. And if they hear that, maybe you have to give yourself grace. That's what I tell new moms. Yes. Okay. You don't have to be perfect. This baby's going to love you. And you just have to give yourself grace,
Yeah. I mean, what is perfection anyway? Like the basic thing that we need to do is make sure our babies are fed and safe, fed and safe, basically.
Yeah.
And so really, we're all learning what that means, and that even is changing what they need is going to change over time as well.
Yeah.
And so just being flexible, I tell my families, giving yourself grace and self-compassion and being flexible are the big three things that will serve you as a parent, and even me, when I brought my son home, he was a preterm infant, and he had to go back on the feeding tube. That was so
How many weeks was he when he was born?
He was 31 weeks, and he was in the NICU for about 5 weeks. And then he did good in the NICU, but when, and when I say he did good, I mean, he did what we expected. Like he had to grow, he had to be treated for jaundice, we had to watch him for apnea and bradycardia spells, but he didn't have to require any major surgeries or anything like that. So in my book, that's a good.
That is very good.
But when he came home, I started to notice after feeding, like different feedings, and like he sounds so congested and like in his nose and in his chest. And so, being a doctor, I knew to worry about aspiration because I know that preemies, airways and their swallowing mechanism can be a little bit premature too. Because like I tell my families, they look good on the outside. They have their eyes, their toes, their fingers, their legs and everything. So everything looks like, well, everything's in place. You're wondering, well, what's wrong? Well, the inside is immature. That part that was still growing and developing was kind of thrusted out, and they were expected to do things that they would not have had to do at the time, Right. And so that was hard, like juggling. I was still in training and then trying to make sure people were watching him, were gonna, mix my breast milk right, because I had to add a little fortified to it to make it, him have the calories he still needed at first. And so just so much. And see, me being a doctor, so that's why I share my story with families, because my being a doctor didn't take away that I still have the stress of it, the strain of it, I still had to ask for help too, because I couldn't stay home if I was going to still finish my training. And so these are still concerns for moms too. Like you're still trying to be like your person who you are, and you still have to take care of this baby. You still had hopes and dreams and things you were trying to do when you found out you had a baby. So I always tell people it's no real ideal time to have a baby, because you still have everything, but if you still don't ask for help, then you still will struggle with the same things, because the needs are still the same. They still need to sleep. They still don't, still need to eat. You still need sleep, but they got to eat around the clock at first, because it's a function of the maturity aspect. Yeah. Speaking to that, so knowing these things, I think will help mentally too, because you're right. Like this notion of you're supposed to look a certain way or, then that makes you feel inept, which that leads to depression,
yes.
anxiety, because you're often comparing yourself to someone else. And so I tell my families, don't compare your journey to anyone. Anytime a family comes to me and tells me somebody else did something else, I ask questions. And they're like, oh, wait. And I'm like, see, your story is not exactly the same.
Everybody's story is different. And that's what people need to understand. And that goes for everything. You know, that really goes for everything. Every person is different. Every baby is different, you know.
Yeah, and there are some standards. So I tell people, in comparison is not bad in itself, because we do need a frame of reference to understand if something's going wrong.
Right.
Because you can't be like la la la, like head in the sand, and your baby's not eating well or not gaining weight. Then yeah. So the thing to do is, if you see something that you think, should my kid be doing that? Then that's the time for education and discussion. It's not to internalize it and say, oh, that means I'm not doing something. It's the time to say, hey, do I need to make sure of something or learn something that different? And if not, like, oh, okay, no, my pediatrician is reassuring me my baby's growing well. Okay, well, that's what I'm going with, because this is a trusted individual. They've given me concrete things to look at, factual things. Because I had a friend who her baby was growing a little bit better compared to, or not better, I would say, growing bigger, I should say, compared, but your baby's on breast milk and that baby was, and so it's different. Like babies who are fed breast milk will sometimes do a little differently than babies who are on formula. Babies, your husband is like 6 some feet tall.
Exactly. I was going to say that. I was like, your husband is 6'2" and this one is 5 feet.
A lot of these babies can be big until they like stretch out. Like my daughter was a big preemie and now she's tall, like because of my dad being real tall. So again, if I was comparing, I could have been like, oh, my baby is a big preemie, and then I internalized that. But I knew enough to know, well, there's nothing wrong with that, so that's why I really, really push. Education is where it's at in all aspects. Education about what your experience could look like, and that flexibility of knowing there's very few things that are just like, it should be this way. And most of the time that has to do with like safety, like otherwise your safety is at risk. Some things is like, it can ebb and flow, like, well, it can depend, and so a lot of times when I'm talking to my patients, I'm like, well, it can depend, but I think they need to hear that, because they do other times get stuck on a thing, and then it's often a detriment.
I just want to go back to one thing. When we talked about relationships, there are certain things that, like we said, should just be right now. For instance, when we take a new baby home and we have older relatives that have had children years ago, they still, a lot of them are still going by the notion you put babies on their stomach to sleep.
Yes.
And the mother will teach him back to sleep.
Yes.
So we're teaching the moms, put the baby on their back. They can do tummy time when you're awake and when the baby's awake.
Yes.
But the relatives don't have that information if they haven't been privy to it. So again, education comes in. And those are some of the conflicts that come up sometimes with the family members, where they're like, I'm your mother, I raised you. I know, I know what I'm doing. And so the conflict of wanting to ask for help, but knowing that that person is not going to do that kind of thing. That's important.
True. That
needs to be, that needs to be a serious conversation with that person. And sometimes that does cause ongoing kind of conflict.
Yes, it can. And setting boundaries. I talked about that too. As one of my tips is the setting boundaries, because you will have family members. I still do. I mean, and I think that people just need to know, like, everybody in some aspect deals with that. And even myself as a doctor, when my kids get sick with something, my mother-in-law will say something, and my husband's always like, well, my mom. And I had to learn, like, not to let that bother me. I'm like, okay, well, that's really a good point, but I'm going to do this way because of this. And I don't take offense to it. So I think the first thing is to recognize that at some point that was their reality.
Right.
And so it's not, most of the time, that they're not coming from a bad place. They actually really believe in the information.
They do. Absolutely. Yeah.
So it's just to say, hey, I get that was the case then, but they've since found, and we're progressing. It's a lot of things that we didn't used to have cell phones, now we do. We didn't used to have a car, now we do. So a lot of things we're progressing in a lot of ways. Right. So just letting them know, like, I think validating that they do have a perspective, but then setting that boundary, like, hey, you got to raise me the way that you at the time was deemed factual and necessary,
safe,
and now that
right.
and safe. And now that I have this information, I need to be afforded that same right,
Exactly.
and
Exactly.
just being plain with it, validate, because a lot of times we take the defensive approach instead of just being like, hey, I get it. I know that you mean well, but I'm going based off of this. And then I always tell my families they can blame me in that way. Just say the pediatrician told me I have to do it this way.
Right.
I say, use me up with last ditch effort, but that is a very real boundary. And see, my kids are 8 and 3. And I still have to deal with that on occasion with certain things. And then sometimes, and then again, that picking your battles, like
Right.
if it's something that she says that, okay, I may not think that they needed the saline or something, but hey, yeah, sure, it's worth a try. Like it's not,
Not a big
it is a viable option. It just may not be that I was going to do it at that time or whatever.
Right,
So,
right.
it's just again, considering that they do care and they want to see the baby do well too,
Right.
and you as a person know that. So that's where that trust and that understanding of that relationship comes from. But that is a real concern. I see a lot of families talk about it in some of the mom groups I'm in about like things with the contentions with their families, especially in-laws. So it may not even be their mom, but it's their mother-in-law, their the dad or the partner's aunts and family, which that already adds a whole nother layer too. and don't let it be that y'all already don't get along and then the baby come up. That right there tips it right over, right? Because it's like, I already wasn't trying to deal with you, and now you're trying to tell me what to do with my baby. So unfortunately, that is being a real.
Hopefully the baby will bond the family.
Yeah, I try to strive towards peace, and anytime I give advice towards that situation, I do try to encourage people to go to the shared ground, and that's where that validation come in, saying, acknowledging that the person does have an opinion. Like I get what you're saying, and that I can understand how you might think that way, but based on this, and I think if you start there, even if
conversation.
they could be like, well, at least they didn't come at me like, no, I'm not gonna do whatever,
Right.
And that just doesn't serve anyone, to be honest, and you end up leaving that kind of conversation frustrated anyway, whereas, and approaching it from a position of love and peace and power, like empowerment versus like conflict,
I try to tell my patients, it's a lot of it stopped during COVID because we couldn't have, visitors at one point, but bring their support people with them to some of their visits, come hear the baby, you could hear the heartbeat, come with her. And then those are the days you try to bring up breastfeeding and you bring up some of the other things that at least they've heard it, or they've met you as a provider and they feel like, okay, this provider is teaching things, that kind of thing.
I like that too, because then they get a feel for you. It's like, yeah, you know what I did, like Dr. J or the other Dr. J. But yeah, then you know what, they were real sound. And most of the times I can see I'm getting buy-in and from the family with different things, even like the grandmas and stuff. And a lot of times people actually approach it from a knowledge area of like, oh, I didn't know we weren't doing that anymore. Because sometimes they really know that, no, we're not putting alcohol, and no, we don't want to need to shake the baby's head. And, sometimes it's just like acknowledging it, like, hey, yeah, we did used to do that. Interestingly,
you remember the belly binders? They used to put money on the umbilical cord.
Yeah. So it's just acknowledging that some of that stuff was a cultural thing, and sometimes the people are honest too, that they don't even know why. They just know that my mama tells me that now, like don't go outside with your hair wet and stuff like that. I'm like, Mom.
Why? I know. We would get cold if we sat on the ground, my mother used to say.
Nothing to do with my immune system, nothing at all. But I know she cares about me. So, when she's around, I just don't do it. But, when I'm not around, I do.
It's things that we've seen, people, there was a story about a young lady that was cooking a certain way. Like she would always put the water in the pot and then pour half out or something.
Yeah.
And it went like generation to generation. And finally someone asked, why does grandma do that? And they said because she didn't have the right size pot. It had something to do with the pot. It had nothing to do
Yeah, I
with
know what you
cooking.
do. Yeah,
But everybody
exactly.
kind of just kept
Kept
doing
on
it.
going. Yeah. So
Yeah.
that's why I actually now, even as I practice medicine, I try to get to the where did this like rule or this
Right.
thought come from?
Right.
And my patients help me with a lot of that too, because when they ask me why, if I haven't gone, I'm like, you know
I
what, let me
don't
go
know.
see
I
why
don't
we don't
know.
do that anymore. The same way
Yeah.
with the alcohol, because it was killing off, it's actually delaying healing of the cord, which,
Right.
that's fascinating. And so my parents asking me those kinds of questions actually helped me to go and research too. So I think as long as you position yourself as somebody that cares about the health and wellness of the baby and the family, most people will be open to discussion, even if it's something they didn't intend to do or didn't want to do. A lot of times they'll be willing to open their minds because they see that you're genuinely coming from a place of trying to make their lives better.
Right. Right.
So one of the other things that we talked about too, or mentioned, that one of the things that mom may not say or express is about being overwhelmed, which is one of the biggest things that I really want to help my families with when I work with them. And it's that sense of when you feel overwhelmed, it's because you feel like things are out of control. And that is normal when you bring home a new baby, because it is that is the one thing to know, that you have no control. If you want to know how much control you really lack, have a
You have
kid.
none. You have a new boss. I always tell my patients, you have a new boss. This is your new boss here for the next, at least for the next couple of weeks, at least.
Yes, exactly. Because it's a lot. Like you've really just gone from one reality to another, and there was no real transition period. That you are in it. That is, this fourth trimester is your transition period, and so just that giving grace and self-compassion, and just knowing, like, sometimes it's just having to talk with yourself, like, okay, that's why I want a mission to spread it. Like, hey, you will be overwhelmed, but you don't have to stay there. You don't
Right.
have to stay
Right.
stuck.
Yeah.
And if you think about it, there have probably been other times in your life where you've been overwhelmed with things, but you were able to get past it or get through it, either through making a decision or getting a certain help or whatever it is, assessing whatever you needed to get to where you were trying to go, and then making moves in that way. And it's the same way as a mom. Some of it is understanding that it is a phase. So them not wanting to sleep at night right now is a phase. That's biologically normal. And but then eventually it becomes where you will actually get some sleep at night. So normalizing that there's phases to this thing, that you don't have to stay overwhelmed even when it does come. It will come, so be prepared for it. But know what are your resources, what are things that you can do for yourself to get out of that situation.
And I think one thing I tell my women is that motherhood doesn't come with a manual. We have manuals for everything else. You buy something, you drive in a car, everything has a manual. Motherhood doesn't come with a manual. And so for the next few weeks, it's going to take time for you and your baby to get to know each other and get in and understand each other, as far as really feeling comfortable, with breastfeeding, to understand what the baby needs. And it's going to come.
Yeah.
But just give yourself time, and it will come. You'll get to know your baby, and you'll start to get into a little schedule or routine, and then you're going to see that overwhelm start to decrease.
Yeah, and that's why for my package, you mentioned your journal, and I'll definitely put a link to that in this post. I'll edit it. But that's why I thought that was a good thing too, like, because sometimes when you're in the thing, and then when you get there, you don't look back and realize how far you've come. And sometimes it takes a period of reflection. Even if you reflect over your pregnancy. While you were pregnant, it was probably moments there. Like, I remember the first trimester I had some bleeding. And so then if I just only focus on the baby, but don't think, you know what, I made it through a couple of little different things I was kind of scared of while I was even pregnant, like pain. Like, sometimes you probably had a little pain thinking, oh, am I going to early labor? Or, oh, Lord, I had a little spotting. Am I about to lose baby? So you've already kind of done it. It's just, sometimes it's just taking that moment to pause and look back and say, hey, you know what? That was scary too, but I made it through that. Right. And so like, hey, this fourth trimester, yes, it's going to be, I'm overwhelmed, but I believe I can make it through that too. And it's having that support, knowing that you having the right support system of people around you and everything too, that helps as well.
Right. Yeah, it is. And I think also with the overwhelm and the sleep deprivation and everything else going on, one thing that I do find with new moms is they're so focused on the baby and maybe the rest of the family that they don't look at themselves. And that's the one piece I want to bring up.
Yes.
How important it is to at least know what's going on with your body.
Yep.
Okay. If she comes, if a mother comes home and she's having a headache, or she has notices her face is puffy, or she's having chest pain or shortness of breath, anything like that, she needs to get back to the hospital to get
Yes.
checked out.
Yes.
There's an increased risk of blood clots at that point, and she needs to come in if she has swelling of the legs, one leg, or pain down the leg, or a line going down the leg, anything like that. If she starts running temperature, she needs to come in. All of those things are, and they get busy and they kind of just don't pay attention to those things. That's what can increase the maternal morbidity and mortality, is missing those early signs.
Yes.
And they're taught in the hospital. I think everyone gets discharged teaching, but right after you have a baby, you're exhausted. You've been in labor, you're exhausted. Yeah, and then you're not hearing. You're thinking about, how am I going to get home? What do I need to do when I get home? You're thinking of all these things when people are trying to teach you and give you instruction. And we hand you discharge papers in the hospital, and many times that's left on the bed when they're gone, because they were packing up. They had the car seat and the baby stuff, and they were gone. So, they need to hear that over and over, what to look for.
Yep.
And in the realm of all of the craziness going on and the overwhelm, they still have to take care of them.
Yep, I agree. I love that, because I remember at the hospital, I had one of her babies was in the NICU, and she was coming to visit, and she was like, "Man, my head is killing me." And I was like, "Have you had your blood pressure checked?" She was like, "No, I said, "Oh no, you about to go right down to this OB office."
That's right.
Right on over there. So then I saw her like the next day. She was like, "Yeah, my blood pressure was up." And and I was like, "See, you're right," because she was worried about her baby in the NICU,
Exactly.
And so I tell my families, even when I met the babies in NICU and they're going back on MAG and things like that, I say, take care of you so you can be present to take care of your baby. If you're not alive, it serves no one.
Right. And like with the high blood pressure and preeclampsia, that can happen up to 6 weeks after the baby's born.
Checking on yourself daily.
Yeah. So it's important that they realize those symptoms and come in and check in with their provider, the midwife, the OB,
Yeah. And that was, with my practice, that's one of the things why I want to do the in-home, is to also be like that little check-in, like to ask those questions, even if it's a weekly, like, after I've seen the baby and stuff the first few days, then like weekly after that, like just a quick phone call. Hey, are you having any of these symptoms? Have you been okay today? And sometimes that 5 minutes, 5 to 10 minutes might make a difference. Like, what, now that you mention it, my eyes were kind of a little blurry the other day. Oh, no, ma'am, we need to stop right now.
Exactly. And 30% of women that die, 30% of them die after they go home or after the baby's born. So that's a large percentage that we could really stop if people knew the symptoms and didn't wait,
Yes. So even, and that's a good point too, like teaching the family as well, having them have a designated person. You give me some good ideas. Like, they should maybe have a designated person that's dedicated to checking on them, every few days, or, weekly at least, and it could be something that can be case by case, but definitely doing it, like just making sure it's being done. Even because, it's interesting to say that about the discharge, we send them home with a lot of stuff, but you're right. Like I didn't read none of, I was a doctor, so, I knew a lot of stuff, but I didn't read it. No, like what people are going to do, they're going to just go either Google something real quick when they have a question, or they're going to call somebody. So really that face-to-face or quick little snippets online, little videos of what to expect, or what are some warning signs and things like that is probably useful. Need a good TikTok on maternal signs at home. Just look out for, and pass that around so people will be thinking, bleeding, headache.
I love the fact that you're going to be following up with these moms. At my hospital, we have a mother baby clinic, and that was born out of the fact that a lot of mothers miss their appointments. They take care of everybody but them. So they would bring the baby to their appointments, but they wouldn't come to the postpartum. So now they're having where the mother is bringing the baby, and there's a midwife there to take care of the mother. So that's excellent. But it's the mother that always cares for everybody. She's like the last person on her list to take
Yeah.
care of herself,
Yeah, and that narrative definitely needs to change. And I've just started encouraging when I send my moms home, I tell them about it. That's part of my discharge instructions now. It's like, don't forget you, and don't forget if the dad is in there, you guys still matter too.
That's
And
right.
so, even if it's once you get comfortable, because I know it's still an adjustment period. That first week, you're gonna feel like, oh, I feel bad for leaving my baby. It's gonna happen. It does. You do feel that way because they're new too. But eventually you realize they're yours forever. So if you don't take time, you never will, because they're not going anywhere. I tell them we have a no return policy at the hospital. So they can't come back. So they're yours. So that means you have to intentionally take
No
time.
return policy. I love that. I love it.
You have to intentionally take time. So it could start small. It could just be like somebody, if you're too afraid to leave, let them be out of your sight per se. Have somebody come to you and just be like you did in the living room, and then you go in the room, or somebody else is tending them, and y'all can do a at home meal and eat out on the patio, or it's just something that's acknowledging that you're acknowledging yourself, that you still matter and that you still need a break mentally, and to laugh and to still enjoy being a person yourself, and so like I'm in my workshop, I'm going to help families think about these things, like what are the things you enjoy now, and like write that down, so that way when you still have your baby, okay, I remember saying I loved like going get ice cream, whatever. Okay, well, make that a point, go do that one thing in that first week, challenge yourself. I'm going to go get me some ice cream at the whatever place, we like to go to Brewster's on Sundays and stuff.
Take a walk and go get ice cream.
Yeah,
absolutely.
You can still incorporate a routine that's even while still having your baby, that's still you taking time for yourself, you still enjoying the life that you've been given,
Right.
And so it's just being intentional, like with everything, like you intentionally went to college or did whatever training to become whatever kind of job or whatever. We're making decisions all the time. And so now we just need to add in making decisions.
Include this little person.
Yeah.
This little human being that we have now. Yes.
Yeah. So that's the way to do it. So I think we've really touched on all of the things, like the big things, which were the breastfeeding and dealing with overwhelm and changes in the family, and taking care of ourselves, and even knowing about our bodies, after birth. And the one big factor adding all of that together is really just knowing that every facet of your life is impacted and will change, but that's okay. Like change comes, but it doesn't have to be detrimental or feel, you don't have to feel defeated. You could be empowered in this new life, because it's also bringing on something special and unique too. I didn't imagine being a parent. I wasn't against it, but I wasn't like one of those that was like, well, I can't wait to have like 7 or 8 kids. Because I do know some people who are like that they were all about the big family, and that wasn't me. I'm an only child, so that could be part of it. I was just always used to being by myself. But I love, if my mom laughs when I say this, but I'm like, I love my kids. She's like, I hope so. But I just mean, it even surprises me how much like I love them, and like just want to do things for them and be around them and like cut up with them. Even when they get on my nerves, I still go back and want to be around them.
Let's go back to the getting on your nerves. I meant to mention one point. I meant to mention that. That is one of the things that mothers will never say out loud. You said it out loud. You're talking about older kids. I'm talking about for a little newborn baby. Mothers never say that, because they've never heard another mother say it. And they feel like it's just them. Okay.
No, you will feel like you want to give them back.
I know. I tell my moms all the time. I said, that's why God made baby so cute. I said, because at 2 o'clock in the morning, when you haven't slept for 2 days, and that baby is up looking at you smiling. I said, they do all their tricks at night. That's when they smile and they giggle and they do all of the cute things. I said, that was God's way of saying, I don't like you right now. You need to go to sleep, but I love you so much. Okay. Yeah, exactly. And I want them to know that I think all of us have had that moment,
Yes, it is. It's because again, it's a change, and any change you resent it at first, even when it's something that's good for you. And I mean, most people probably felt the way. I tell people when I got married, I was trying to get divorced like every week for like the first year. Like, like, wait a minute, because I hadn't lived with him before. None of that. I didn't have no transition, no book either.
You had no frame of reference, huh?
Yeah, no frame of reference either. It was the same thing. I was like, wait a minute, all in my space. It's the same thing with a baby, because you are like culture shock. I mean, my first son, he was in the NICU, so I actually did sleep the first couple of weeks. So, but when I had brought my daughter home, I remember thinking, man, why do I feel so tired? And then I remember, because I actually was up around the clock with her, whereas him, I actually went to sleep at night because he was in the NICU. So I had pumped enough milk, and he had enough to last him through the night till I can come back at 8 or 9 o'clock the next morning. So I had a bit of a different transition with him compared to her coming home right away. And so I had to even realize that for myself.
Now, a few things we haven't touched on, just touch on it very briefly. There's other help other than your immediate family, your partner. There are lactation consultants, and doulas are excellent. You have a doula that can come in, and support you during the pregnancy and postpartum also. That's awesome. And if you're if mom is having some difficulty breastfeeding, lactation consultants, those are people that can help you and guide you, and so that you don't feel overwhelmed and hopeless. You can call them first before you give up. You call.
Exactly. And that I appreciate you bringing that up, because that's part of it too. When I was thinking of even my own services, like helping to add those folks into my network for my families, because then that's something too, knowing ahead of time. That's why I'm talking about this postpartum planning. If you know ahead of time, I am going to be in a situation where my mom or my sister or my whoever can't come and do some of the things, especially the things that a lot of the doulas, which is what they'll do, provide some practical and emotional support as well. Then you can budget that in. That's something that somebody can give you.
Part of your baby shower gifts.
Instead of buying clothes till they're 12 months old. They don't need 12-month clothes right now. They just need onesies. And
they don't need 200 onesies.
They can buy some clothes.
They probably get him 25 of them and 75.
If everybody pull together and say, you know what, we're gonna all pull together and give you a big old box of diapers, a big old box of wipes,
doula, enough money to get a doula.
Get a doula, because as things come, or they could just be committed to, we're gonna be like your team of support over that three. So if you need some more clothes, in the second month, hey, I'll step up and buy you, a couple of outfits or whatever. But, so having your, in another talk, I call it like your 911 crew. That's what you need to have. Like, who are the people you're going to call in an emergency, and who's going to be like the people that's going to get you where you need to be. You start thinking about that ahead of time, because again, with planning, it makes you feel a little bit more in control. Your anxiety will be a little bit less, because once you're in a situation, oh wait, I kind of already thought about this, like who I might need to call, or who has said they'll be willing to help me in this situation or that situation, or I already know who the lactation consultants are in the community. Like, so that helps along with that postpartum depression and anxiety that could come on as well. Yeah. Good. Yes. Well, I've loved this conversation, and I probably put this into a couple of clips, because we've touched on so many things. So we can put these into clips. So if people need to listen to a specific part of it as well, they can kind of listen to the piece that meets the question they might have about like breastfeeding, or what other forms of support, like the lactation and the doula and things like that. We can
do. This is a World Doula. This is a World Doula Week. So
it is.
Any doulas that are listening, we appreciate you. You are so needed and necessary.
Yes, you are. Because again, we talked about it. Moms are having babies in isolation, or even that the family dynamics are just so different now too. And even the dads, like a lot of them are really just don't know what to do.
Right. And the doulas support the whole family, which is very good.
They support the whole family. And so that's so good. So that's what I love. And that's what I want to do with my business. So Dr. J, tell people how they can find you or follow you on social media or your websites.
You can find me on Transitions Women's Health Consulting. It's at www.transitionswomenshealth.net.
Okay.
And I'm on Facebook and I'm on Instagram.
Okay, and I will put that information in the notes for this live. And then I'm Dr. Just Daigle, and I actually have an upcoming webinar March 29th to the 31st. Called Adjusting to Motherhood, Developing Your Postpartum Plan. So I'm going to talk about a lot of what we talked about today, which I've broken them up into like 5 pillars, and then helping you figure out what it is, the preferences that you would have for your family that will help you be successful in your 4th trimester. I am also out up for a one-on-one consulting program for any families that need help. I call myself the mentor, advisor, consultant, and strategist for families. So it's the 4th trimester max program. So if you go to www.momandmemd.com/MACS, which is short for mentor, advisor, consultant, and strategist, because I love to do all of that for families, because moms sometimes they need a little bit of mentoring. Sometimes they just need advice. Sometimes they have questions about the care of them or their baby. Sometimes they just need some tools like, well, hey, I know where I'm stuck, but I need some help figuring out what kind of plan I need for myself. I'm happy to help you with all of that, because it's really in totality what's going to help you thrive and not just survive your 4th trimester. So all of that information we will put in the notes here. Thank you for those of you who have joined. If you're watching the replay, put hashtag replay. I will divide this into clips and put it on my YouTube channel, Just Daigle MD, and that should be up by this weekend. But thank you, Dr. J, so much. I've loved talking with you. I think you're doing such great work. I'm so glad that we connected and that we're helping moms in this space, because it's so important. Because I mean, how moms' journeys get started really has a long-term impact, on how they feel about themselves as parents, and even how they parent their kids and their attitude towards their babies and stuff. So we want to do all we can to help them feel empowered and confident as they start their motherhood journey. So I hope that you have a great weekend and take care of yourself.
Okay.
Thank you, guys.
Bye.